So this is inferior area because we are holding the skull upside down. This is the skull. Normally to study the basalis we are turning it like this. So this comes the inferior surface of hard palate. Okay. So this is inferior surface. Now we are seeing this is incisive fossa. If you see posterolaterally, here is the greater palatine fossa, foramen, greater palatine foramen, and just behind it there are 2 to 3 lesser palatine foramens. Okay. Greater palatine foramens, from greater palatine foramens passes the greater palatine nerves and vessels. From lesser palatine foramens passes the lesser palatine nerves and vessels. You can see a groove extending from greater palatine foramen which extends up to the incisive fossa through which the greater palatine vessels travel. Okay. So this was about the hard palate. Now also there is premaxilla, which is a part of hard palate. The part of hard palate which encloses the 4 sockets for incisors. These 2 for central incisors and these 2 for lateral incisors. This triangular shaped portion in the anterior part of the hard palate is the premaxilla. Okay, this is called as premaxilla. Now coming to the middle part of the Norma basalis. So this was anterior part which we had already discussed. Now coming to the middle part of Norma basalis. It extends from posterior border of hard palate to the imaginary line passing from anterior border of foramen magnum. So to study the middle part of the Norma basalis, it is divided into central portion, okay, and the lateral portions. Okay. So first we will discuss about the central portion, this one. First and foremost, you can see the 2 openings here. These are the posterior nasal openings. These are also called as choana. Okay. Choana, which are divided into 2 by the vomer bone. This is a vomer, which is a bone of nasal septum. This is the posterior border of vomer bone. Okay. Now you can see this vomer is splitted superiorly. Now again remember, this is inferior, this is superior. So this superiorly the vomer articulates with sphenoid bone and inferiorly it articulates with superior surface of hard palate. Okay. So superiorly the posterior border of vomer splits and this splitting plates of vomer are called as ala of vomer. This is ala of vomer. Okay. Now this ala of vomer articulates with these are the pterygoid plates. This is vomer, this is ala of vomer. Now these are the pterygoid part of the sphenoid bone. Okay. It has medial and lateral pterygoid plates. Okay. This is the medial pterygoid plate, this is lateral pterygoid plate. Now this is this medial pterygoid plate. You can see inferiorly it is showing a bony projection called as bony hook called as hamulus. Pterygoid hamulus. You can see this is pterygoid hamulus. Okay. As you trace this medial plate upwards, you can see it is splitting and enclosing a scaphoid fossa. This is scaphoid fossa. Okay. And the fossa between medial and lateral pterygoid plate is pterygoid fossa. Okay. The area enclosed by splitting of the medial pterygoid plate is scaphoid fossa and the fossa between medial and lateral pterygoid plate is pterygoid fossa. Okay. Now what is attached in the scaphoid fossa is tensor villi palatini muscle which originates here, passes downwards, winds round the hamulus and comes and inserts on the hard palate posterior part in front of the or behind the palatine crest. Okay. So tensor villi palatini originates in scaphoid fossa, comes down the tendon, winds round the hamulus and inserts over the posterior part of hard palate. Okay. After that, this is the lateral pterygoid plate. This lateral pterygoid plate, on its medial side, it gives origin to the deep head of the medial pterygoid muscle, and laterally the lateral side of the lateral pterygoid plate, if you see it like this, okay, it forms the medial wall of infratemporal fossa, and the lateral side of lateral pterygoid plate gives attachment to the head of lateral pterygoid muscle. So lateral pterygoid plate, medial side medial pterygoid muscle, lateral side lateral pterygoid muscle. Okay. Now this ala of vomer in the midline, the superior border of vomer in the midline articulates with the body of sphenoid here. Okay. The body of sphenoid articulates with the occipital bone. Okay. So this bony bar behind the vomer is formed by body of sphenoid and occipital bone. Okay. This is a primary cartilaginous joint which is fused at the age of 25 years, and this joint is responsible for antero-posterior length or antero-posterior growth of the skull base. Okay. Now this vomer articulates with body of sphenoid. Ala of vomer articulates with palatine bone here, horizontal plates of palatine bone, and this medial plate of the medial pterygoid plate gives a process called as vaginal process. Okay. So it extends between the ala of vomer and the sphenoid bone. Okay. So you can see this one canal called as palato-vaginal canal, okay, between the horizontal plate of palatine bone and vaginal process of medial pterygoid plate. Whereas another one here, you can say this is the vomero-vaginal canal. This is between the ala of vomer and the vaginal process of medial pterygoid plate. Okay. The vomero-vaginal canal do not give passage to any important structure, but the palatino-vaginal canal gives way to the pharyngeal nerves and vessels. Okay. So this is palatino-vaginal, this is vomero-vaginal canal. So this completes our middle part of the okay. So now up till now we had discussed the anterior part of skull base or Norma basalis. Now we will start with middle part of Norma basalis, which extends from posterior border of hard palate to the imaginary line passing from anterior border of foramen magnum. Okay. Now this, for convenience of studying this middle part of the Norma basalis, it is divided into middle region or median region and the lateral region. Okay. So first we will discuss the median part or the middle part of the Norma basalis. Now in this you can see here two openings. These are the posterior nasal openings called as choana, separated by the posterior border of vomer. This is the vomer bone which is separating two posterior nasal openings. This is posterior border of vomer. If you see properly superiorly, now we have turned the skull upside down. So this is superior. Superiorly the vomer is articulating with the body of sphenoid. Inferiorly it is articulating with hard palate. Now superiorly, when it is articulating with body of sphenoid, it is splitting into two parts. Those are called as ala of vomer. Okay. Behind this vomer, this is a bony bridge up to the foramen magnum. This bony bridge is formed by body of sphenoid and the occipital bone. Okay. Now this occipital bone at some distance from the anterior margin of foramen magnum shows a tubercle called as pharyngeal tubercle. Okay. So this is a bony bridge and the posterior border of vomer in the midline. Now coming to the lateral region in the middle part of skull base. So in the lateral region we see two parts of sphenoid bone and three parts of temporal bone. So this is pterygoid part of sphenoid bone, this whole, and this is greater wing of sphenoid. For temporal bone we will see the petrous part of temporal bone, tympanic part of temporal bone. This is tympanic, petrous, tympanic and squamous part of temporal bone. Okay. So two parts of sphenoid bone, pterygoid and greater wing of sphenoid, and 3 parts of temporal bone: petrous part, tympanic part and the squamous part. Okay. So first we will see the pterygoid part. This is the pterygoid part of sphenoid bone, which consists of medial and lateral pterygoid plates. You can see it is extending it lies behind the third molar tooth. Okay. This is the medial pterygoid plate, this is the lateral pterygoid plate. This is the posterior margin of medial pterygoid plate. If you see properly, the medial pterygoid plate, when it goes upwards, it splits and encloses a fossa called as scaphoid fossa. Okay. Scaphoid fossa is in between the splitting of upper part of medial pterygoid plate. If you trace this posterior margin downwards of the medial pterygoid plate, you can see a projection called as humulus. This is the humulus. Okay, pterygoid humulus. And if you see properly, the posterior margin of the medial plate shows a tubercle called as processus tuberalis in the middle of the posterior border. This processus tuberalis, along with the upper part of its posterior border, gives support to the auditory tube. Okay. Also, you can see the medial surface of the medial pterygoid plate forms the lateral wall of posterior nasal opening. Okay, choana, and here opens the auditory tube or the eustachian tube. Okay. Now coming to the lateral pterygoid plate. This fossa between the medial and lateral pterygoid plate is called as pterygoid fossa. This is the lateral pterygoid plate. This lateral pterygoid plate, on the lateral side, it forms the medial wall of infratemporal fossa. This is infratemporal fossa. It forms the medial wall of it. On the medial side, the lateral pterygoid plate gives origin to the deep head of medial pterygoid muscle. On the lateral side, it gives origin to the inferior head of lateral pterygoid muscle. So, medial side medial pterygoid, lateral side lateral pterygoid muscle. Okay. Now, this medial pterygoid plate, when extends towards the vomer, it gives its one process called as vaginal process of pterygoid plate. Okay. And in the upper part, it articulates with the palatine bone here. Okay. So, here it forms the palatovaginal canal. This is palatovaginal canal. Okay. And this vaginal process of pterygoid plate also articulates with the vomer bone, ala of vomer, forming vomerovaginal canal. So, this is vomerovaginal, this is palatovaginal. Okay. So, vomerovaginal canal gives way to the pharyngeal nerves and vessels, whereas palatovaginal canal do not give way to any important structure. Okay. So, these are the important things here. Now, one more thing I would like to note here. This junction or the union between the body of sphenoid and the occipital bone, this joint is primary cartilaginous and it fuses at the age of 25 years, and this joint is responsible for antero-posterior length of the skull. You can say skull base. Antero-posterior length of the skull base is regulated by this primary cartilaginous joint between the sphenoid and basi-occiput. Okay. After this, coming to the greater wing of sphenoid bone. This is greater wing of sphenoid bone. It is roughly pentagonal in shape. Okay. It is having anterior border which forms the boundary of the infraorbital fissure, infraorbital foramen. Then anterolaterally there is a sphenoidal crest. This is sphenoidal crest. Posterolaterally it articulates with the squamous part of temporal bone, and posteromedially it articulates or it forms the union with the petrous part of temporal bone. Okay. So, it is quite pentagonal in shape. After that, if you see on the posteromedial part, this part of the greater wing of sphenoid shows various foramen. This is foramen ovale, this is foramen spinosum. Okay. Okay. So, greater wing of sphenoid, which we had already seen, but I would like to repeat the boundaries of greater wing of sphenoid in this skull again. So, greater wing of sphenoid is pentagonal in shape anteriorly it forms the inferior-lateral boundary of the inferior-orbital fissure here. Okay, inferior-orbital fissure. Okay, then anterolaterally it is marked by the sphenoidal crest. Laterally it articulates with squamous part of temporal bone. Medially it articulates with pterygoid. Okay, so we were discussing the infratemporal surface of greater wing of sphenoid. It is pentagonal in shape. So anteriorly it forms the boundary of the infratemporal foramen. Okay, infraorbital foramen, sorry. Then this anterolaterally it is limited by the infratemporal crest. Laterally it articulates with the squamous part of temporal bone. Medially it articulates with the pterygoid part of sphenoid bone, and posteromedially it articulates with the petrous part of temporal bone, and posteromedially it shows various foramens. So here are the foramens. This is foramen ovale, which is important, and this is foramen spinosum. Okay, ovale and spinosum. Sometimes two more foramens may be present, such as this. You can see foramen of Basalis between the scaphoid fossa and the foramen ovale, and sometimes there may be an additional foramen between ovale and spinosum called as foramen innominatum. So this foramen ovale transmits four structures. The mnemonic is MALE, male. Mandibular nerve, so we were at the foramen ovale. It transmits four structures. MALE, M for mandibular nerve, A for accessory petrosal vessel artery, then lesser petrosal nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. So these four structures goes from foramen ovale. Spinosum transmits three structures, that is triple M: middle meningeal artery, middle meningeal vein, and meningeal branch of mandibular nerve. Okay, so these are the foramens on this aspect. After this, in this skull you can also properly see the palatino-vaginal canal. This is the vaginal process of medial pterygoid plate, and this is the palatine bone, and this is the palatino-vaginal canal, and this is the vomerovaginal, between the ala of vomer and vaginal plate of medial pterygoid, vaginal part of the medial pterygoid plate. Okay, so we had already seen vomerovaginal gives way to the pharyngeal vessels and nerve, whereas palatino-vaginal do not transmit any important structures. Now, just behind this ovale spinosum, there is one projection of the greater wing of sphenoid. This is called as spine of sphenoid. This spine of sphenoid gives attachment to two muscles and three ligaments, and also it is related to two important structures, that is two nerves. On its lateral side it is related to auriculotemporal nerve. On its medial side it is related to cauda tympani nerve. Both these nerves carry secretomotor fibers for the salivary glands. Auriculotemporal nerve on the lateral side carries secretomotor for the parotid gland, and cauda tympani on the medial side carries secretomotor for the submandibular and sublingual gland. Two muscles attached to the spine of sphenoid are tensor villa palatini and tensor tympani, and three ligaments. Okay, so we had seen this is the spine of sphenoid, which gives attachment to two ligaments, and three ligaments and two muscles. Two muscles, tensor villa palatini and tensor tympani. Three ligaments. One is pterygospinous ligament between the pterygoid plate and the spinous process of sphenoid bone. Then spinomandibular between the spinous process of sphenoid bone and the mandible, spinomandibular, like this. And one is anterior ligament of malleus, which is a ligament of internal ear. Okay. Now if you see here, between the posteromedial part of greater wing of sphenoid and the apex of petrous part of temporal bone, this is a sulcus. This is called as sulcus tubae, where lodges the cartilaginous part of the auditory tube. Okay. Then this is the foramen lacerum. This foramen is lacerum. It is called as lacerum because of its irregular margin. It is bounded anteriorly by body of sphenoid and greater wing of sphenoid, posteriorly, posterolaterally by the apex of petrous temporal bone, and medially by the body of occipital bone. This is foramen lacerum. In its anterior wall there is pterygoid canal, from which passes the nerve of pterygoid canal or median nerve. Then this is the apex of petrous part of temporal bone, and this is quadrilateral area just behind the apex, which gives attachment to the levator villi palatini muscle. Behind. Okay, so now we will discuss about the posterior part of the Norma Basalis. So I told you posterior part of the Norma Basalis lies behind the imaginary line passing through the anterior margin of Foramen Magnum. Okay, so in the midline of the posterior part of Norma Basalis there is Foramen Magnum. As you can see, this is the largest foramen of the base of skull. It is oval in shape. Its diameter is more anteroposteriorly than transversely. Okay, posteriorly it is bounded by the squamous part of occipital bone, on both sides by the condylar process of occipital bone. Anteriorly is the body of occiput. So these are the condylar process of occipital bone which articulates with the first cervical vertebrae, that is atlas, to form the atlanto-occipital joint. After that, this foramen magnum gives passage to many structures. It is this, for the passage of structures, it is divided into two parts by the attachment of alar ligament, which is attached on medial side of the condylar process, alar ligament, which divides the foramen magnum into anterior and posterior compartment. Now in this diagram, only this one. In this diagram you can see, this is the diagram of structures passing through foramen magnum. This is the alar ligament in yellow color. This is anterior part, this is posterior part. So anterior compartment gives way to the three ligaments. First one is apical ligament of Dens. Then second one is longitudinal part of the cruciate ligament. And third one is membrana tectoria. So these are in turn attached to the clevis on the inner side. Clevis is on the inner side of the interior of the base of interior of the skull. So this passes from the foramen magnum and are attached on the clevis. So anterior compartment is also called as osteoligamentous compartment, as it gives passage to the ligaments. Then posterior compartment, from the posterior compartment passes the lower part of medulla oblongata. Along with that there are anterior single spinal artery and posterior two spinal arteries. Okay, posterior spinal arteries are two, anterior spinal arteries single. Then right and left vertebral arteries and spinal part of the accessory nerve. Okay, so these are vascular as well as nervous structures. So this posterior compartment is also called as neurovascular compartment. Anterior is osteoligamentous, posterior is neurovascular. Posteriorly, spinal cord do not pass from the medulla foramen magnum. It is the lower part of medulla oblongata which passes from the foramen magnum along with anterior, posterior spinal arteries and vertebral arteries as well as spinal part of accessory nerve. So this was about the structures passing through foramen magnum. Now if you see here this condylar process, below it on the anterior side there is one foramen. This is hypoglossal foramen or hypoglossal canal for the 12th cranial nerve. Okay, it is on the anterior side of the condylar process. Posteriorly you can see the fossa. These are condylar fossa for accommodation of the posterior margin of articular facets on atlas. Okay, sometimes there may be the foramens here which are called as posterior condylar foramens, and it gives way to the emissary veins. Okay, now if you come laterally, here is one important foramen called as jugular foramen. Okay, this jugular foramen is divided into three parts: anterior part, middle part and the posterior part. Okay, this jugular foramen is bounded anterolaterally by the petrous part of temporal bone and medially by the condylar part of occipital bone. Okay, the anterior part of the jugular foramen, from that part passes the inferior petrosal sinus, and from the middle part passes three cranial nerves, that is 9th, 10th and 11th cranial nerve, and from the posterior part there passes the internal jugular vein. Also you can see this fossa, jugular fossa. This is for accommodation of the superior bulb of internal jugular vein. Okay. In this diagram here, these are the structures passing through jugular foramen. Anterior to the jugular foramen there is carotid canal. So this is internal carotid artery passing through that. And these are the three nerves passing through the jugular foramen along with internal jugular vein. Okay. Okay. So these are the structures. You can see this is the carotid canal and this is the jugular foramen. Okay, for the structures. Now if you come more laterally, this is the styloid process. Okay. This styloid process, anteriorly it is covered by the sheath formed by lower margin of tympanic part of temporal bone. Then this is the styloid process. Behind it, this is the mastoid process. Between styloid and mastoid there is one foramen called as stylomastoid foramen. Stylomastoid foramen, from this passes the facial nerve. It comes out from this stylomastoid foramen, facial nerve. Now this styloid process gives attachment to 3 muscles and 2 ligaments. Okay. That together it is called as styloid apparatus. Okay. It gives attachment to 3 muscles. These are stylohyoid, styloglossus and stylopharyngeus. Stylohyoid goes to the hyoid bone which is below the styloid process. Styloglossus goes to the tongue anteriorly and stylopharyngeus goes to the pharyngeal wall medially. Okay. 2 ligaments are stylopharyngeus and stylohyoid and stylomandibular ligament. 2 ligaments are there from the styloid process. Then this is the mastoid process. If you see on the medial side of the mastoid process there is a groove. This is for passing of occipital artery. Okay. This is related to occipital artery. And 3 muscles are attached on the lateral surface of mastoid process. That we will see. After that, this is the posterior margin of foramen magnum. From the midline, you can see one crest is passing to the external occipital protuberance posteriorly. This is the external occipital crest. From the external occipital protuberance, there is superior nuchal line. Okay. So this is the external occipital crest up to the external occipital protuberance. From the external occipital protuberance there arches the superior nuchal lines. Okay. From the midpoint of this external occipital crest there are again 2 lines arching on both sides. Those are called as inferior nuchal lines. Okay. And there is an imaginary line further passing diagonally which divides this area into 4 parts for the attachment of muscles. Now we will see which muscles are attached there. So this is the foramen magnum. Okay, this is external occipital crest, superior nuchal line, inferior nuchal line from the middle of the external occipital crest. Now superior nuchal line gives attachment to 2 muscles. You can see here trapezius muscle. Okay, and the occipital belly of occipitofrontalis. Then the area between the superior and inferior nuchal line gives attachment to semispinalis capitis. Okay, the area between superior and inferior nuchal line gives attachment to semispinalis capitis. Further, the area between inferior nuchal line and posterior margin of foramen magnum gives attachment from medial to lateral, first to the rectus capitis posterior major, rectus capitis posterior minor, medially, major laterally, and obliquus capitis superior more laterally. Okay. So these are the 3 muscles between the inferior nuchal line and posterior margin of foramen magnum. Now I had already mentioned that on the lateral side of the mastoid process there is attachment of muscles. So first one is sternocleidomastoid. This is sternocleidomastoid. Its name only suggests sternocleidomastoid, means it is having its origin from sternum. Cleido means clavicle, sternum, clavicle, and it inserts on mastoid. Okay. Second muscle is splenius capitis, and the third muscle is posterior belly of digastric muscle. Okay, these three muscles are attached here. Now if you can see this marking just behind the jugular foramen, there is attachment of rectus, capitis, lateralis. Okay, so these are the attachment in posterior part of the Norma basalis. In this diagram also you can see just anterior to the anterior margin of Foramen Magnum, you can feel one tubercle called as pharyngeal tubercle. On its both sides there is attachment of muscle called as rectus capitis anterior, and more anterior to it there is longus capitis. So here is rectus capitis anterior, here is rectus capitis lateralis, and here is rectus capitis posterior minor and major. Okay, anterior, lateralis, and minor, posterior major. Okay, after these are all insertions in blue color. Okay, then here I already mentioned the area, quadrilateral area anterior to the carotid canal gives attachment to levator villi palatini muscle. This scaphoid fossa, which is formed by the bifurcation of the upper margin of the medial pterygoid plate, which forms the scaphoid fossa, there is origin of tensor villi palatini muscle. Medial side of the lateral pterygoid plate gives origin to the deep head of medial pterygoid. Okay, and the inferior surface of the temporal greater wing of sphenoid bone gives attachment to the lateral pterygoid muscle. Okay, so these are the muscles attached on the base of skull. Thank you.